Have you ever walked into a project and felt completely lost about where to start? Everyone has their own version of the truth. Sales blames operations, operations blames suppliers, and the customer is stuck in the middle. That chaos is exactly why the SIPOC tool exists. It's the map that gets everyone speaking the same language before the real problem-solving begins. And if you're pursuing your Six Sigma certification, mastering SIPOC will help you start every project with confidence and precision. SIPOC is an acronym that stands for suppliers, inputs, process, outputs, and customers. It's one of the simplest yet most powerful tools in the Six Sigma toolbox, typically used in the define phase of the demake process. Think of it as the wide-angle lens for understanding your process at a high level before diving into the data. It gives you a bird's-eye view of how work flows from the start to the finish, from the people who provide what you need to the people who receive the final result. Let's break it down in plain English. Suppliers are the sources that provide your inputs. Inputs are the materials, information, or resources your process needs to function. The process is the series of steps that transform those inputs into outputs. Outputs are the products or services your process produces. And customers are the recipients of those outputs, either external customers who buy from you or internal teams who rely on your work. It's that simple, but when you put all those pieces together in one visual map, suddenly the process becomes clear to everyone involved. Here's a practical example. Imagine a hospital trying to reduce delays in its patient discharge process. Complaints are piling up. Patients are frustrated by long waits, nurses are stressed, and doctors are rushing paperwork. The Six Sigma team decides to start by creating a SIPOC diagram to understand the flow. They gather key people in a conference room: doctors, nurses, billing staff, and IT support. On a whiteboard, they draw 5 columns labeled S, I, P, O, and C. Under suppliers, they list who provides key inputs: doctors supplying discharge orders, nurses providing medical summaries, the pharmacy supplying medications, and IT providing patient information systems. For inputs, they write down the necessary resources: completed medical records, medication lists, insurance details, and patient transport availability. Then comes the process column, where they outline the major steps in simple terms: review the doctor's order, confirm medication, complete billing, prepare discharge paperwork, and escort the patient out. They keep it high level, avoiding minute details, because the goal is to capture the entire flow from start to finish. Under outputs, they list what this process produces: a discharged patient, updated medical records, and finalized billing. Finally, in the customers column, they identify who receives those outputs: the patient, the insurance company, and the hospital's administration. Within an hour, everyone can see the full picture. The confusion starts to melt away. The billing team realizes they're often waiting for data from the doctors that wasn't being sent consistently. The pharmacy notes that medication reconciliation sometimes happens too late in the process, creating a bottleneck. By simply mapping it all in a SIPOC, the team uncovers several handoff issues they couldn't see before. They haven't analyzed a single data point yet, but they already have a list of likely improvement opportunities. That's the power of SIPOC. It aligns people quickly. It stops debates about how things really work by getting the facts on the table. When everyone can see the same process flow, hidden dependencies and communication gaps pop right out. It's not about blame, it's about visibility. Now, if you're working toward your Six Sigma certification, it's important to remember that SIPOC isn't just a formality, it's a foundation. Too many green belts and black belts rush past it because it seems simple, but skipping this step leads to messy projects later. Without a SIPOC, teams often dive straight into data collection without even agreeing on where the process starts and ends. That's like building a house without a blueprint. A common pitfall is making the SIPOC too detailed. It's meant to be a high-level summary, not a full process map. You don't need to list every click, every document, or every step. Keep it simple enough that an executive could understand it in 2 minutes. Another mistake is failing to include the right people. A SIPOC built by one department in isolation will always be incomplete. You need perspectives from all major stakeholders, suppliers, process owners, and customers to make it accurate. Another issue is treating SIPOC as a one-time exercise. In reality, it's a living document. As you learn more about the process during your Six Sigma project, you should update it. Maybe you discover new suppliers or find that the customer's expectations have changed. The SIPOC should evolve with your understanding. Let's go back to the hospital example. After the team builds their initial SIPOC, they realize that the discharge process actually starts earlier than they thought. Some hospitals include early discharge planning right at admission to ensure smoother transitions later. They adjust their SIPOC accordingly and then use it to scope their DMAG project. That update helps them define clear boundaries for measurement and improvement. And here's something many professionals overlook. SIPOC is also a communication tool. When executives ask, "What's this project about?" showing them a clean SIPOC instantly explains it. They see who's involved, what flows through the process, and who the end customers are. It helps them visualize the business impact in seconds. You can even use SIPOC in non-manufacturing settings. For example, an IT team launching a new help desk system can build a SIPOC to clarify who supplies support tickets, what inputs are required, what steps agents follow, what the outputs are, and who the customers are, employees requesting help. In marketing, you could use it to map the campaign creation process, from content suppliers to customer engagement outputs. The structure is universal because every process, no matter how digital or manual, has suppliers, inputs, processes, outputs, and customers. For anyone serious about their Six Sigma certification, SIPOC represents more than just a diagram. It's a mindset. It teaches you to think systemically. Every process is part of a larger network of interactions. When one part falters, the rest feel the impact. SIPOC helps you see those relationships clearly before you dive into data analysis or root cause investigations. It's the bridge between the problem statement and the measurable work ahead. Another benefit of SIPOC is that it naturally drives better teamwork. When you bring people from different functions together to build it, they start to see the process through each other's eyes. The billing department suddenly understands the doctor's workload. The nurses see why IT systems are so critical. The exercise builds empathy and breaks down silos, which makes collaboration smoother throughout the project. If you want to make your SIPOC truly effective, focus on clarity, use straightforward language, avoid jargon, describe the process as it actually happens, not how it's supposed to happen, and don't get hung up on making it perfect the first time. It's better to have a rough draft that sparks conversation than a polished chart nobody uses. In the end, SIPOC is one of those deceptively simple tools that deliver massive value. It's like turning the lights on in a dark room. Suddenly, you can see where everything is, who's responsible for what, and where the biggest risks or inefficiencies might hide. That visibility gives you control, and that control gives you confidence. The kind of confidence that sets apart professionals with Six Sigma certification. The takeaway is simple. Whenever you start a new process improvement project, start with SIPOC. Don't skip it, don't rush it, and don't underestimate it. It's your roadmap, your translator, and your alignment tool all in one. Build it carefully, update it often, and use it to keep everyone pointed in the same direction. Because when everyone sees the same process, solving the right problem becomes a whole lot easier. And that's what Six Sigma is all about. Making improvement simple, systematic, and successful.